Dear organizers, thank you for giving me the opportunity to say something about chronic pain from the patient's perspective. Ladies and gentlemen, dear believers, in the past, people with chronic pain weren't taken seriously. There was no way you could have pain once the underlying condition was taken care of. Hypochondriac, lazy, work scum, idiots, poseurs. These are some of the nice words people used for chronic pain patients. It was not only the people in the street who called them that. Healthcare professionals, politicians, policymakers, they all did that. And why? Because they didn't understand the problem. And what easier way to get rid of the message than to blame the messenger and do nothing? Doesn't work. And we...
Oh, here it is.
Yes. And we, the patients, less educated, not empowered, overwhelmed by what was happening to us, didn't talk back. We believed the educated people. We went home thinking we were crazy, blaming ourselves for our situations and suffering in silence. Or we were locked up in some kind of mental facility as thought we were seeing ghosts. And although I have hearing problems, I can hear you think, well, this is a situation from the past century. It's only 16 years ago. But let's talk about some facts on that. A couple of years ago, in the period 2012-2014, Pain Alliance Europe, together with the Active Citizens Network and supported by Grunenthal, did the Pain Patients Pathway Recommendations Project. This involved retrieving information from 3 levels of involved parties: health ministries, patient and civic organizations, and the healthcare professionals. And the questions concerned 5 different patients' rights: the right to be believed, the right to have treatment of pain management at the earliest possible stage, the right to have access to the best possible technologies and to treatments, the right to be informed about all options and make an informed choice, and the right to live with the least amount of pain possible. And if you have done this for diabetes or heart conditions, every one of those questions would probably have got scores from 90 to 100%. And I'm not going to bother you with all the details of the project because we have done that before, but I would like to highlight one of them, and in our opinion, the most important one: the right to be believed. And keep in mind, this is what the different groups reported by themselves. And as institutions are saying that only 45% of them believed the patients. And from the patients, that feeling was only 44%. But the most scaring factor is that the professionals, only 77%, believed their own patients. And I'm not going to debate whether it is 77 or 75 or 79, but it just shows that even nowadays, when we have discussed for so long and so much about health economics and about participation in society and about learning in the period we should stay at work, we are still not in a situation where we are being believed by the first people we met. And it says something about the ethics of the people dealing with people with chronic pain. And say also something about the legislations on chronic pain, developed with the regulative terms mentioned earlier in mind, not with the idea of supporting people. It's just with the idea of punishing people. Punishing because they have chronic pain. And because they don't understand it, you're a poseur. So you should punish them and not support them. If I would have an exam and I have 77% of the score, I would be very happy. But if I'm going to see a doctor and I face it only that I have the opportunity that 1 out of 4 of them don't believe me, then that's not good. And if you translate that to European figures, that would mean 25 million patients, chronic pain patients, actively seeing a physician who doesn't believe him. And that would be more than there are people living in the Baltic states, Finland, Denmark, and Bulgaria together. So that's a huge problem. It should change now. Yes. Oh, I can't go back, of course. Yes, I can. Dear all, when I started, I called you believers. And that's the reason why. I shouldn't have told you this story because I know you are convinced of the need of changing things. But I'm afraid that those 23% of physicians, healthcare professionals who were reported not to believe, won't come to this kind of events, as they are lacking enough education to identify the problem. And that problem is much bigger as one would think. But beware, before going too enthusiastic, having 77% of the physicians believing us doesn't mean anything about the quality of care they provide. Believing is not the same as having a good therapy offered. And this is a topic we discussed last year, SIP, education of healthcare professionals, education of patients, education of society. And that education of society would mean awareness campaigns, would mean prevention campaigns. Just plain information that chronic pain is not only for chronic pain patients, but it's also there for their loved ones. It's also there for their employers. It's also there for the governments. It's not just simple the patients who was involved. So yes, there is a big need to improve pain care. And there's a big need also to involve the patients in the actions to improve that care. Because, wasn't it said, nothing about us without us. Dear all, I'm so happy with the discussions we had yesterday on the 4 topics as they go to the heart of the matter. Oh, it should move forward. So that's yes. Pain as an indicator. This would open ways to improve the quality of care and in that way improve the quality of life of chronic pain patients. And that's what we are fighting for. Pain as a disease or a symptom. If fully discussed, this also would open doors to better management and also improve the quality of life. Pain and cancer. You don't have to be a fortune teller to understand that this is an improving factor in the quality of life. And pain and rehabilitation and reintegrations, as mentioned, works in improving the quality of life. And as for PEA, the mission is to improve the quality of life of people living with chronic pain in Europe. This would be great if we would get into that. Now. So yes, indeed, it is time for action. It is time to move forward of just talking, but doing something. And that is the outcome of this SIP, putting forward to the European Parliament, to the European Commissions, and to our members, I would say, and I would like to have effect that would do also, saying to their members, translate it also into national policies. Because talking in Europe doesn't solve the problems. Talking on national level will help. But before we get there, we do need to believe each other. And when we achieve that, we can not only speak to each other, but also are able to listen to each other. And together find solutions. And as we all know, there's no simple solution that fits all. Thank you for your attention and your belief in the patients, as we, the patients, believe in you. Thank you.